Hi, Dr. Henry. Pfizer today has announced that they're nearly ready for a vaccine, saying it's 90% success rate, and Trudeau says he's going to welcome it into Canada when approved. Just wondering, what is your initial reaction to this seemingly great news, and what does it mean for us here in BC?
Yeah, I think it's fantastic. We've been following all of the vaccine developments really, really closely. We had some early results from the Moderna vaccine not that long ago. This is preliminary results that have been released by Pfizer, so that's the caveat. We have not yet seen the data. It has not been published publicly, but it is really positive news, and I'm quite excited about it. This trial continues. It's a phase 3 trial in humans, and there's about 44,000 people in the trial, so that's the good news. And it's being done in a number of countries where COVID has been surging. So one of the things that happens in this type of trial is some people, it's blinded, which means nobody knows who got the vaccine, who got the actual vaccine, and who got a placebo vaccine or another vaccine. So what they have said is the preliminary analysis that they've done on a subset of this shows that there's good effect from the vaccine. So that's great news. I think it's fantastic. And that means that we're on track for potentially having this vaccine available both in around the world, but here in Canada and in BC in the first quarter of 2021. That's assuming everything else continues on the positive light. So that is one of the light at the end of the tunnel. The challenging thing with this vaccine is that it needs to be stored at ultra low temperature, -70. And so there's not a lot of -70 freezers that are available in our communities. And it means the logistics of getting this vaccine are going to be complicated. But we are working, the BC CDC has been working with Health Canada and the Public Health Agency and across this country to make sure we have the logistics in place to get the vaccine as soon as it's available and approved for use, as soon as the safety has been confirmed, and that we know who the vaccine is going to work best in. So those are the things that we're working on, and I'm quite excited. I think it's not going to be easy, but early in 2021, we should have vaccine to add to our tools to stop this pandemic.
Do you have a follow-up, Rebecca?
I do. Thank you so much. And Trudeau is saying it'll be available in the first 3 months. Do you think that's possible with these logistics? It sounds -70 sounds very difficult. And is 90% good enough? Because that obviously still means 10%-ish aren't protected. What do you think about those?
You know what? When we talk about vaccines against a virus like this, 90% is really good. We know that if we get at least 50 or 60% protection, that is going to make a major difference in stopping the spread and protecting people. And that's what we need to think about first. The vaccine's going to be in limited supply. We're not going to be able to give it to everybody at once. But we can give it to people who are more likely to have severe illness and protect them. So 90% is great because we have those other measures to prevent transmission as well and to protect people. So I'm thinking, and the National Advisory Committee on Immunization put out priority groups for immunization. So if we can protect our seniors and elders in the community in long-term care, if we can protect healthcare workers so that we can prevent outbreaks in our healthcare settings and make sure that we keep our healthcare system working, those are things that we need to focus on. It's going to be challenging, but we are thinking through all of the ways of making that work.